Hello everyone and welcome back to Shikha Therapy. I am Lalit Parihar. We are going to discuss a pharmacokinetic today, commonly understood through the four process of ADME. ADME stands for absorption, distribution, metabolism, and excretion. In simple words, pharmacokinetic explains what the body does to the drug. First, let us understand what is pharmacokinetic. Pharmacokinetic explains the movement of a drug through the body over time. We can understand this movement through four basic steps. First is absorption. In absorption, the drug moves from its site of administration into the systemic circulation. Systemic circulation means blood circulation. Second is distribution. Once the drug enters the blood circulation, it travels from the bloodstream to different tissues and organs of the body. Third is metabolism. The drug is chemically transformed mainly in the liver into their metabolites. They are generally easier to eliminate. And finally, we have excretion. In this step, the drug or its metabolites are removed from the body, mainly through the kidney and urine. So remember, this is simple sequence: absorption from site of absorption to blood circulation, distribution blood to body tissue, metabolism drug to metabolite, ठीक है, breakdown into the metabolites, and excretion out from the body. Absorption. Absorption is the movement of a drug from its site of administration into the systemic circulation. The rate and extent of drug absorption depend upon the several factors like route of drug administration, lipid solubility of that particular drug, molecular size of that drug, degree of ionization, available surface area for absorption, and blood flow. Gastrointestinal motility, food and drug interaction may also affect the absorption of oral drug administration. Now compare the oral route with the intravenous route. After oral administration, the drug must first dissolve and then cross biological membrane before entering into the blood circulation. Therefore, absorption is required and the drug may also undergo first pass metabolism. In contrast, after intravenous administration, the first drug directly enters into the systemic circulation. So, there is no absorption step is required and the bioavailability is considered 100%. सो सिंपली याद रखिए, ओरल रूट में एब्जॉर्प्शन होता है और आईवी रूट में डायरेक्टली ड्रग ब्लड सर्कुलेशन में चली जाती है, इसलिए आईवी रूट का जो बायो अवेलेबिलिटी है वो ज्यादा होती है. देन mechanism of drug absorption. Drug can cross biological membrane through different mechanisms. First and most common mechanism is passive diffusion. Passive diffusion, the drug moves from an area of higher concentration to lower concentration. The process does not require energy. Most small and lipid soluble drugs are absorbed from this mechanism. The second mechanism is facilitated diffusion. It is a carrier mediated process, but it does not require ATP or any cellular energy. The drug moves along its concentration gradient with the help of certain carrier proteins. The third mechanism is active transport. It is also a carrier mediated transport, but unlike facilitated diffusion, because it requires energy in the form of ATP. फैसिलिटी में फैसिलिटी प्रोवाइड हो रही है, फ्री में काम हो रहा है, और एक्टिव ट्रांसपोर्ट में एनर्जी ली जा रही है, यानी कि कुछ हमें पे करना पड़ रहा है ड्रग को मूव करवाने के लिए. इन एक्टिव ट्रांसपोर्ट कैन मूव सब्सटेंस अगेंस्ट द कंसंट्रेशन ग्रेडियंट. इसमें कंसंट्रेशन ग्रेडियंट मतलब कि लो कंसंट्रेशन से हाई की तरफ भी हमारी जो ड्रग है वो जा सकती है. Next is endocytosis. In this process, the cell membrane surrounds the substance and form a vesicle to carry inside the cell. तो engulf कर लेती है, ऐसे खा लेती है सेल. आपने पढ़ा होगा phagocytosis, pinocytosis, like that process. This mechanism is particularly important for some large molecules and particles. One another mechanism is filtration. Here small water soluble molecules move through pores or paracellular space. This movement mainly depends on the size of the molecule and the size of available pores. So the key point is most small and lipid soluble drugs are absorbed primarily by passive diffusion. So जिसका मॉलिक्यूलर साइज सबसे छोटा होगा, लिपिड में सॉल्युबिलिटी सबसे ज्यादा होगी, वो सबसे ज्यादा मेम्ब्रेन को क्रॉस करेगी, उसका एब्जॉर्प्शन सबसे ज्यादा होगा। और जिसका मॉलिक्यूलर साइज सबसे ज्यादा बड़ा है और लिपिड में सॉल्युबिलिटी कम है, तो उसके चांसेस कम है एब्जॉर्ब होने के। After absorption, the next step is distribution. Distribution is the reversible transfer of drug between the blood and different tissues of the body. Drug distribution does not occur equally in all organs. Well-perfused organs such as brain, heart, liver, kidney and lungs receives drug rapidly because they have a high blood supply. Moderate perfused tissues such as muscles and skin receive the drug comparatively more slowly, and in poorly perfused tissues such as adipose tissues and bone, they show slower distribution. Several factors affect drug distribution. These includes blood flow to the organ, capillary permeability, protein plasma binding, tissue binding, and lipid solubility. An important concept here is protein binding. In the blood, some drug molecules remain bound to plasma protein, such as albumin, while some remain in the free form. Generally, the free drug can cross biological membrane, distribute into the tissue, and interact with the receptors. Another important barrier is blood-brain barrier, which restricts the entry of many drugs into the CNS, central nervous system. So the major takeaway is that distribution determines how and how quickly a drug reaches its site of action. सो जो बॉन्ड ड्रग होती है, प्रोटीन से बाउंडेड ड्रग होती है, वो प्लाज्मा में मूवमेंट देती है और उसको जब क्रॉस करना होता है ब्लड सर्कुलेशन से किसी टिश्यू में, तो फिर उसको प्रोटीन से रिमूव होना पड़ता है, फ्री होना पड़ता है। फ्री फॉर्म में जब ड्रग होगी तब वो एक्शन शो करने के लिए अवेलेबल होगी और वो प्रोटीन्स जो हमारे रिसेप्टर प्रोटीन है उनसे बाइंड कर सकती है। अगर वो किसी और प्रोटीन से बाइंड है तो फिर वो रिसेप्टर प्रोटीन से बाइंड नहीं कर पाएगी और एक्शन शो नहीं कर पाएगी। Then metabolism. The third major process of pharmacokinetics is drug metabolism, also known as biotransformation. वर्ड से आपको पता चल रहा है बायो में ट्रांसफॉर्मेशन, बायो मतलब लिविंग, ट्रांसफॉर्म मतलब वन स्टेज से दूसरे स्टेज में कन्वर्ट हो जाना। तो ड्रग मेटाबॉलिज्म कन्वर्ट्स लिपोफिलिक और फैट soluble drugs into more polar or water soluble metabolites, making their elimination from the body easier. The major organ involved in drug metabolism is the liver. However, metabolism can also occur in other tissues. Drug metabolism is broadly divided into phase 1 and phase 2 reactions. Phase 1 reactions includes oxidation, reduction and hydrolysis. These reactions introduce or expose functional groups in the drug molecule. uh, there is some enzymes like cytochrome P450 enzymes. They are plays majorly important role in this metabolism process. And phase 2 reaction are mainly conjugation reactions. They includes glucuronidation, acetylation, methylation and glutathione conjugation. These reactions generally make the drug or its metabolites more water soluble. Now let us understand the first pass metabolism or first pass effect. When an oral drug is absorbed from the intestine, it passes through the intestinal wall and liver before reaching systemic circulation. So during the journey, a portion of drug may be metabolized. As a result, a reduced amount of unchanged drug reaches the systemic circulation. This is known as first pass metabolism. अच्छा ये बताइए, आपको पता है कि इंटेस्टाइन से लीवर तक ले जाने के लिए कौन सी ब्लड वेसल्स यूज होती है? तो मैं आपको बता दूं उसका नाम है पोर्टल वेन, एंटेरोहेपेटिक सर्कुलेशन। तो इंटेस्टाइन से जब लीवर में हमारी ड्रग जाती है एब्जॉर्ब होके, तो वो एंटेरोहेपेटिक सर्कुलेशन के थ्रू जाती है। तो मीन्स अगर हमने 100 mg की टेबलेट खाई है, उसमें से हमारी 90 mg या 95 mg एब्जॉर्ब हो गई, हमारी इंटेस्टाइनल वॉल को क्रॉस कर गई, तो लीवर में जब वो जाएगी तो उसका मेटाबॉलिज्म होने के चांसेस हैं। तो सपोज 10% 20% ड्रग वहां पर मेटाबॉलिज्म हो गया, तो हमारी 50 60 70% ड्रग ही हमारे सिस्टमिक सर्कुलेशन में पहुंच पाएगी। तो जो अमाउंट एक्टिव फॉर्म में या फिर एक्शन करने के लिए अवेलेबल है हमारे ब्लड सर्कुलेशन में, उसको हम बोलते हैं बायो अवेलेबिलिटी। द रेट एंड एक्सटेंट ऑफ ड्रग रीचेस इनटू द सिस्टमिक सर्कुलेशन इन अनचेंज फॉर्म, यानी कि एक्टिव फॉर्म में जितना अमाउंट हमारा ड्रग का ब्लड सर्कुलेशन में पहुंचेगा आफ्टर फर्स्ट पास मेटाबॉलिज्म, उसको हम बोलते हैं बायो अवेलेबिलिटी। क्लियर है? The final step of ADME is excretion. Excretion is the process by which drug and their metabolites are removed from the body. The major route of drug excretion is through the kidney and urine. Renal excretion mainly involves three important processes. First is glomerular filtration. Only the free or unbound drug present in the plasma can be filtered through the glomerulus into the bovine space. Second is tubular secretion. In this process, drugs are actively transported from the blood into the renal tubule fluid. Third is tubular reabsorption. Some drugs, particularly lipid-soluble drugs, may move from the tubular fluid back into the blood, यानी कि reabsorption हो जाता है. Finally, the remaining drug and its metabolites are eliminated through the urine. Apart from the kidney, drug may also be excreted through bile, feces, lungs, sweat, saliva, and breast milk. Urine pH also influence the excretion of certain drugs through a process known as ion trapping. So the key point is the kidney is the major organ of drug excretion, and renal clearance determines how rapidly many drugs are removed from the body. Now let us connect pharmacokinetics with clinical practices. Why is ADME important for healthcare professionals? Because understanding pharmacokinetics help us select the right dose, right route, and appropriate dosing interval for each patient. The dose determines how much drug should be given. The route determines how the drug enters the body, and the dosing interval determines how frequently the drug should be administered. Safety is also important because pharmacokinetic knowledge helps reduce toxicity, adverse drug reaction, and also drug interaction. Now let us quickly summarize ADME. Absorption, drug moves from the site of administration into the blood. Distribution, the drug moves from the blood to different tissues and reach its site of action. Metabolism, the drug is biotransformed mainly in the liver. The excretion, the drug is metabolized or removed from the body. So understand ADME help us move towards personalized drug therapy, improved efficacy, increased safety, and minimize toxicity. In simple words, understanding the journey of a drug helps us use that drug more effectively and safely, so that we so that our introduction of pharmacokinetic and ADME has learned how a drug is absorbed, distributed, metabolized, and finally excreted from the body. So understanding pharmacokinetics help us use medicine safely, effectively, rationally for better patient care. In next lecture, we will discuss drug absorption and bioavailability in more detail. Thank you for watching Shikha Therapy by Lalit Parihar. If you found this lecture helpful, please like the video, share it with your friends, and subscribe to the channel. Keep learning, and I will see you in the next lecture. Thank you so much.